Hi, I'm Paul Harper. I'm 54 years old and I've had a heart attack. I woke up with pressing on my chest. My wife was concerned that I may be having an heart attack. At that point, I didn't think I was because I had no breathlessness. I wasn't in pain at all, and we called the ambulance.
My name's Jonathan Stubbins. I had a heart attack in this very shop.
My name's Clive Shears, I'm aged 64. Started getting pains down my arms and my chest. I was worried a bit, to be quite honest, with wife being present. I says, I think you better call ambulance. I think I'm having a heart attack.
So I couldn't believe it had happened. To tell you the truth, it was just unreal. Everything just seemed unreal. The world just seemed to stop.
I didn't know whether I'd be able to carry on with my business. I was worried about the future. I was worried about my partner Gloria being able to carry on. Really, my confidence was shaken.
I felt that it was unfair because I'd looked after myself all my life and I couldn't understand why somebody as fit as myself had had a heart attack, really.
It's changed my life totally. Couldn't work anymore.
I've got 2 young children. Can I still go on playing with my kids, doing what I do with my children and having a full life like I normally do?
I felt apprehensive, scared, didn't know what was happening.
I'm Wendy, I'm the cardiac rehabilitation team leader for Bassetlaw Hospital. The Community Cardiac Nursing Programme is a programme of information, exercise and support for patients who have had a cardiac event. Each patient is assessed individually to find out what their requirements from the cardiac rehabilitation programme is. The options that are currently available are structured education and exercise classes, or they can have a home-based programme if they so desire. So the patient is always at the focus of everything that we do in cardiac rehabilitation. It isn't only about information and exercise. The support is vital for a patient that's had a recent cardiac event or a cardiac diagnosis. A lot of patients are very, very affected by anxiety and depression, and that is also something that we have to focus on. So we give information on lifestyle changes that need to take place to keep a patient healthy. We also teach the patient how to exercise safely and correctly, but it is the emotional support that is vital for someone that's had a recent cardiac event, and to put them back into the community and return to it as normal life as possible. Our motto really is that the patient comes first. No matter what we need to do for that patient, we will change it to make sure that they have the outcomes that they require.
The programme made me feel a lot better and more confident in myself, where everything was structured and where people explained everything to us.
After the first week or 2, you could generally feel an improvement in your health.
The more you got into it, the better you felt. It was very relaxed. It was fun, if I'm being honest.
Another important aspect was the diet and the need for exercise.
Now, because I've been educated and I can manage my own condition, I know what to do and know how far to push myself.
They do teach you how to think outside of the box, think smart.
I actually went online and the information is all there at your fingertips, and I actually found it quite easy. I could look at the heart conditions, treatments, meals, exercises, and also it spurred me on to my recovery.
I found what was really helpful was the social part of it.
Meeting people with the same sort of situation what I was in.
You're not on your own and other people are experiencing what you're experiencing.
It does boost your esteem.
This job is so satisfying, not just for me but for all of my team. We see our patients from being very, very unwell all the way through their recovery process, all the way through their rehabilitation programme to the end when they're fit, healthy and are ready to leave us and go and resume normal life.
Now, after the programme, I feel really confident, bubbling, and I feel fit.
I feel absolutely fantastic.
They've given me another chance and the future seems bright.
I feel positive about the future and knowing that I've got people that I can actually phone up and talk to.
The team on the rehab course are essential to anybody, and I'd like to thank them because I am where I am today because of those guys.
It was very nice to have staff to help and care for you. Like Loads.
Thank you for saving my life.